आज के इस एपिसोड में हम चर्चा करेंगे इंसोम्निया के बारे में। तो इंसोम्निया जो है, जिन लोगों की नींद अक्सर जो है पूरा नहीं होता है और उसमें अन्य लोगों के तुलना में जो है वो क्रोनिक बीमारियों का जोखिम अधिक हो सकता है। तो जो ये अनिद्रा इंसोम्निया उसके कारण को जो है जानना और समय रहते यदि इसका इलाज कराना जो है काफ़ी फायदेमंद साबित हो सकता है। तो नींद नहीं आने की स्थिति में जो है खुद से ही लोग अनावश्यक दवाई जो है वो लेना चालू कर देते हैं। नींद न आने की स्थिति में खुद से ही लोग नींद की गोलियां लेना शुरू कर देते हैं और जो है इसका कई गंभीर नुकसान हो सकता है। तो आज के इस एपिसोड में जो है हम चर्चा करेंगे ये नींद आने की समस्या के बारे में डॉक्टर अरुण कुमार से। तो चलते हैं डॉक्टर अरुण के पास और जानते हैं कि ये आज के युवा पीढ़ी में जो है ये नींद की समस्या जो है वो क्या नुकसानदेह हो रहा है।
Thank you. Thank you, Dr. Chandan. What you have given description of the insomnia. That is a type of sleep disorder where the patient is not able to fall asleep or maintaining the sleep and may have the both condition. So I will tell you that it has many factors which is responsible for the insomnia. First of all, which is the common in this era, is the stress. Stress and anxiety is the most common factors where person become unable to fall asleep in the night, and person becomes very anxious, and at the time he is not able to maintain the sleep. It can have the irregular sleep schedule, means irregularity in the sleep patterns. Patient go to bed at different times, not at a particular times. This irregularity at going to the bed or trying to sleep is cause of the sleeplessness or insomnia. Poor sleep hygiene. This is very common nowadays. We are seeing in the day-to-day life that even the child, they are busy in the mobile and they are sleeping, trying to sleep. Sometimes persons are seeing the TV, looking to TV or video or playing the games, trying to sleep. So these are the causes where the proper sleep hygiene is not maintained. Even sometimes before going to the bed, patient takes some tea or coffee. That is also cause of the insomnia. Some medical conditions, certain conditions like the pain, allergy, or other sleep disorders are also responsible for the insomnia. Medications can have the effect on the sleep that usually disrupt the sleep, disturbance in the sleep. Now coming to the symptoms, what are the symptoms? How we can diagnose that a patient have the sleep disorder? So what you have told that is the patient is difficulty in the falling asleep, waking up too early, not maintaining the sleep, unable to get back sleep, always feeling tired in the daytime, or after awakening patient always feel laziness. So that daytime sleepiness. These are the some symptoms of the as insomnia. Difficulty in concentrating on any topics or remembering the things, that is also seen in the insomnia. That is also a common symptom. So now coming to the, we can explore more the what I have told you, that mainly frequent awakening. What I have told. These are the common symptom of the insomnia. That is, patient is not able to maintain, always feeling laziness, tiredness, mood is swinging. Patient have we can say mood have like the irritability or anxiety, depression, or mood swings. These are the mood disorder which is mainly found in the insomnia. Increased risk of accident or errors, like more prone to mistake or accidental due to fatigue. These are the common symptom of the insomnia. Ongoing worries about sleep. These are the also symptoms. Feeling anxious or frustrated about the sleep problems. Patient is very frustrated And what I told you, that the focusing on the task, that is the type of the difficulty in the concentration, not paying proper attention or recalling information, feeling unfreshed or after sleep. That is, now after this we can focus on the topic like the how can we treat, what is the treatment part for the person who is not able to sleep. So the first part is that we should have the lifestyle changes, counseling, in some cases medication like the CBT, cognitive behavior therapies. Maintaining the sleep hygiene is a more common therapy which is given to the insomnia patient, like the maintaining a sleep schedule even at the weekend. It is crucial for creating treating the patient for the sleeplessness or insomnia. Comfortable for the comfortable sleep. Stress management, what I have told you, that the most common factors is the stress. So how you maintain, reduce the stress in day-to-day life, or reducing the anxiety. So some relaxation exercise is there, mindfulness is there, yoga can reduce the your stress, it improve the sleep by reducing the anxiety. Cognitive behavior therapy, this is the mainly given in the psychiatric basis or psychiatric OPD. That is a therapy which addresses the thoughts and behaviors that contribute to insomnia, offering a strategy to maintain the anxiety. Sleep restriction, this is also the type of therapy where the patient is limited time in bed to encourage more consolidated sleep. That is, we the duration of the bed for the patient is limited, that is reduced, so that they have a consolidated sleep. Relaxation techniques like the deep breathing, meditation, or guided imagery can help calm the mind and body. These are the some sort of strategy to reduce the insomnia. Now, one technique is the stimulus control. This technique involves associating the bed with sleep only, where avoiding other activities in the bed. So that is the stimulus type of thing. Patient should be prohibited from other activity like the seeing the TV or mobile or play game or video game or any activity which is electronically not very sound for the sleep. That should be avoided. Medication, we can know that sedative like the benzodiazepines or other medicine can also going to help. Over the counter remedies that like the melatonin may help regulate the sleep, but their effectiveness can vary. Now, one should have a doctor consultation should be there, individualized treatment should be there. Long term management have the different techniques. Like the for long term management should be interfered in the chronic condition, and it may require ongoing treatment and self management techniques. One term is the individualized treatment, that is most effective treatment in the insomnia, where the individual's needs and the severity of the patient is reduced. Now, coming to the, you can explore more medications. I know the alprazolam or zolpidem, clonazepam, or in the severe condition, like tramadol and like lorazepam is also used. And now coming to what should be the best therapy. So American Academy of Sleep Medicine guidelines prescribes for the cognitive behavior therapy. That should be the initial treatment, and relaxation or medication therapy should also be there. What I have already told, that this helps in the reduction of the stress and more fruitful for the anxiety reduction. So one question is there, is permanently insomnia, or it is a permanent thing, or it is a short term of things. So it can have the both type of things. Now the common questions sometimes happen, that sleeping pills are best or not, or what sleeping pills should be there. So I will tell you that some popular sleeping pills are the doxepin, like the temazepam, triazolam, oramelton, suvorelaxant, trazodone, istazolam, or isopolone. That is mainly used. Now coming to the what I have told that insomnia, how insomnia is a life-threatening thing. So I already told that it may happen the cause of the accident. So and second thing, sleeping pill like the doxepin and ramelton. These are the best treatment for the insomnia patient. But there are some risk in such cases. So we should always start such medication with consultation of the either expert person, some sort of psychiatric intervention is also there, and root cause should be investigated. What are the root cause? A relaxation technique like the deep breathing with a comfortable and calming sleep environment. The environment should be very calm. Means I want to tell that the person where he want to go to the bed, that environment should be very calm, conducive for the initiation of the sleep, and fresh condition. Now coming to the 478 breathing method, what patients should do. Now the progressive muscle relaxation and visualization can help promote the relaxation and faster sleep onset. Now create a relaxing sleep environment. How? What I have told that environment should be re- very conducive. So what are the intervention? So first to dim the light. Ensure that your bedroom is the dark room, quiet and a comfortable temperature. Limit the screen time. Avoid screens like the phone and the tablets for at least an hour before the bed. Means I want to say that if a person is going to the bed, mobile should be switched off 1 hour before to the bed. Tablet should be switched off. TV should be switched off. Video should be every game should be switched off. That is the type of the to limit the screening time so that the environment will be conducive. Ensure a comfortable bed. Use a mattress that suits your preference. Ensure your bedding is comfortable. Now, second thing, practice relaxation technique like the deep breathing 478 breathing means inhale for 4 seconds, hold your breath for 7 seconds, and exhale slowly for the 8 seconds, like 4 7 and 8 means what I have told. Again I want to repeat: inhale for 4 seconds, then hold your breathing for the 7 second, and exhale slowly for the 8 second. That is the 478 technique of the breathing. Progressive muscle relaxation. How you relax the muscle? First of all tense and then relax each muscle group in our body. Means first the flexor group of the wrist, flexor group of the ankle, flexor group of the thigh, flexor group of the knee, then extensor group. Then these are the progressive muscle relaxation therapy. Next is the visualization. You visualize the uh, a thing which give the coolness, like the imagine a peaceful and calming imagine a peaceful and the calming scene to distract yourself from racing thoughts. Second thing is the mindfulness and awareness. Focus on the present moment. Like instead of focusing on sleep, try to present with your body and breathing. That is the I want to say that is the mindfulness, focusing on the present moment. Observe thoughts without judgment. That is the most useful part of the treating the insomnia patient. When thoughts arise, acknowledge them but don't dwell on them. Just acknowledge. You write on the diary, or you just write on something, and don't be distracted, because thought will come, but we have don't be judgmental, or don't be focusing on it. Now coming to the additional tips, how we will treat the insomnia patient. Limit the caffeine and alcohol. What I told you before going to the sleep, any sort of the beverage like the alcohol or tea or coffee should be avoided. Eat a light snacks. If you are hungry, a light carb-rich snack might help reduce the sleep. Listen to calming music. You listen the music which giving the coolness, you that make you calm. That is also the sleeping going to make you sleep. So music, the top of the nice music, that should be promoted. Music should be very nice. Consider a bedtime routine. Always follow a routine. A consistent bedtime routine can signal to your body that it is time to sleep. Means कि that should be some sort of routine, that this time I have to go to the bed. That should always be kept. It is not should be that today you are going to sleep at a 9 o'clock, tomorrow 10 o'clock, and day after tomorrow 11 o'clock. No, that should be prohibited. 5 minutes before or after, that is okay, but you should not change your time of the sleeping. So that should be followed. Now, common question generally, Dr. Chandan, I have told you, what is the best sleep tablet for everyone? The most effective choice individual, it depends on the individual. Means a single tablet is not going to help you. That should be, we can choose from the diphenhydramine or doxylamine or melatonin, valerian root. That we can choose what medication is going to help. Sometimes benzodiazepines like the triazolam, temazepam, stazolam is going to help you. Z drugs, that do the zolpidem, zolpidem, isopiclone, orexin receptor antagonist, sometime like the suvorexant and lomberexant block orexin, and that
तो अभी हम आपको लेके चलते हैं, एक मरीज़ हैं जो कि इनको बहुत दिन से इस तरह का समस्या का सामना करना पड़ रहा था, अनिद्रा का समस्या का सामना करना पड़ा था। और ये जो अनिद्रा होता है, ये दौड़ती भागती ज़िंदगी में सिर्फ सेहत का जो ख़्याल रख पाना सभी उम्र के लिए एक बड़ा चैलेंजिंग हो गया हुआ है। अब देखिए, आपका कितना उम्र हो रहा है?
मेरा 40 साल।
40 साल उम्र हो रहा
जी।
है। और आप कहाँ से आए हुए हैं?
मैं दार्जिलिंग से हूँ।
दार्जिलिंग से आप आए हुए,
जी।
बहुत बढ़िया।
दार्जिलिंग वेस्ट बंगाल।
ठीक है। और देखिए, यहाँ पर इनका ट्रीटमेंट वगैरह प्रोटोकॉल भी यहीं से फॉलो किए हैं। और अभी आपको क्या प्रॉब्लम क्या हुआ था आपको?
मुझे नींद नहीं आ रहा था।
हाँ।
और मुझे नींद नहीं आ रहा था, कब से मैं सोने का कोशिश कर रहा था, फिर सोने नहीं पा रहा था। और जब मैंने वीडियो देखा तो यूट्यूब में अरुण सर का, जो डॉक्टर अरुण सर का, तब मैं यहाँ पे आ गया।
बहुत बढ़िया।
तब से जब दवाई वगैरह लेके थोड़ा अभी रिलीफ है, नींद आ रहे हैं, अभी आराम से थोड़ा सो रहा हूँ। पहले तो मैं नींद एकदम ही नहीं आ रहा था, उसी की वजह से मेरा थोड़ा एक्सीडेंट भी हो गया, ये पैर भी थोड़ा बिगड़ गया। नींद ही नहीं आ रहा था।
अच्छा, ये जो पैर आपका एक्सीडेंट के कारण ही बिगड़ा हुआ है नहीं?
जी।
क्या काम करते हैं आप?
मैं ड्राइविंग करता हूँ।
अच्छा, ड्राइविंग
ड्राइविंग करता हूँ, इसलिए मुझे नींद ही नहीं आता था, इसलिए मुझे ये थोड़ा टेंशन भी रहता था, वो ज़्यादा गाड़ी कुदाने में भी ऐसा भी प्रॉब्लम होता था, इसलिए मेरा वो एक्सीडेंट थोड़ा सा ये हो गया। इसलिए मैं अभी ये यूट्यूब में डॉक्टर अरुण सर का ये सब देख के मैं आया हूँ, तभी इधर मैं उसका हॉस्पिटल में आया हूँ। अभी तो मुझे थोड़ा ये दवाई वगैरह लेके थोड़ा अभी नींद आ रहा है।
कितना दिन से आपका ट्रीटमेंट चल रहा है?
ये पूरा लगभग आपका 1 महीने से चल रहा है।
अच्छा, 1 महीने से आपका ट्रीटमेंट चल रहा है
जी।
और बहुत ही आपको कितना फ़ायदा, कितना कम से कम यहाँ?
फ़ायदा तो पूरा 100% ही हो रहा है।
अच्छा, बहुत बढ़िया।
जी,
कितने दिन से आपको ये समस्या था, जो नींद का आने का समस्या कितने साल से
ये
था आपको?
ये लगभग आपका 3-4 साल से था।
अच्छा, 3-4 साल से था।
जी।
ठीक है, प्रॉपर तरीके से यहाँ ट्रीटमेंट हो गया है, आपको अब अच्छा नींद आ रहा है।
जी, अभी अच्छा नींद आ रहा है।
अच्छा, अच्छा, बहुत बढ़िया। तो देखिए, ये इस तरह का जो है, ये अब नवयुवक है, लेकिन अभी इनका उम्र 40 साल हो रहा है, और अभी इस तरह का जो लाइफ स्टाइल जो होता है, जो खान पान के कारण से हो गया, या फिर जो भी डॉक्टर साहब जो देखे हुए हैं, तो इनको जो है नींद का समस्या आया हुआ था, और जो अब समस्या जो है इनका काफ़ी हद तक सही हो गया हुआ है, और भविष्य में जो है इस तरह का बीमारियां जो है जो मामला है काफ़ी बढ़ रहा है, और इसमें युवा पीढ़ी खासकर जो है तरह तरह की समस्या से वो जूझ रहे हैं।